new research models for Alzheimer's disease are needed. And traditionally, the research has used transgenic animal models. But how about diseases like Alzheimer's disease? When disease is more complicated, there are also sporadic forms of Alzheimer's disease. And for that, we need better models. We have had models like induced pluripotent stem cells, iPSCs, but usually these cells model only, for example, one mutation in Alzheimer's disease risk gene. But we would be curious to have models that would model also the epigenetic alterations occurring in the brains of patients with Alzheimer's disease. And for this, one potential model could be olfactory mucosa cells. Olfactory mucosa cells can be obtained from the olfactory mucosa located in the rooftop of the nasal cavity. It's the area responsible for the sense of smell. Loss of smell is usually linked with neurodegenerative diseases, and usually it is reported even before clinical symptoms. And in histological sections of patients with Alzheimer's diseases, there have been noticed accumulation of A beta in the olfactory mucosa. This would make the olfactory mucosa an interesting research model. We can obtain it with the biopsy, relatively non-invasively, culture the cells in vitro, and study also the epigenetic alterations occurring in these cells. The biopsy can be taken even repeatedly, which makes it interesting for follow-up studies, since Alzheimer's disease is a progressive brain disorder. And to study that, we perform single-cell sequencing from the cultured olfactory mucosa cells derived from patients with Alzheimer's disease and their age-matched, cognitively healthy controls.